I am Dr. Goutam Guha, neurologist in Calcutta, and associate professor of neurology at Kolkata Medical College. I will be talking something about epilepsy in general. Epilepsy is a problem which is very common in general population, both in children and in adults, including the old persons also. It is a problem of electrical connections in the brain which occasionally goes abnormal and produces various kinds of problems in patients, which can be at times very violent, abnormal movements, or at times the patients can lose consciousness, resulting into falls and injuries which might be occasionally fatal. Epilepsy is not a problem related to any God's curse or any sins done in previous life, which is a commonly held misconception. It is actually a problem in our brain which causes abnormal connections or electrical discharges, producing various kinds of abnormal movements of our body. At times it can also present with some staring looks, chewing movements, or abnormal activities which can at times lead to a misconception that the person has gone mad as he is behaving abnormally. Epilepsy is not related to any kind of madness or any kind of psychiatric problem. So, epilepsy should not be taken as a curse of life. One of the common questions in the population which is asked to us is whether it is curable or not. Most of the epilepsies, majority of them are absolutely curable and the patient can be absolutely symptom free or without any attacks for prolonged periods of time. So it can be easily cured, but the problem is continuation of the drugs or taking the drugs or medicines regularly is the most important part of treatment in epilepsy. The first thing is, when an epileptic attack occurs, what should be done by the person standing next to him? He should not panic or do something which will be injurious to the patient. Rather, the most important thing is he should make the patient lie down and turn on one side and look at his airways, that means his nose and mouth. If anything is obstructing his nose or his mouth, should be immediately cleared. Like a very common problem is old person having a false tooth in his mouth, which can dislodge and go into his windpipe. So that must be cleared or taken out of his mouth if possible. Any kind of tight collar, belt or tight shirts should be loosened up and the neck should be made straightened, with the patient lying on his side. The importance of making the patient lie down on his side is an acute attack of epilepsy can produce lots of saliva in the mouth, which he can take in with his breath. So when he lies on his side, it drains automatically through his mouth and his mouth is cleared of the full saliva. After clearing the mouth from any false tooth or any other thing which is obstructing the mouth, the collars and the shirt should be loosened up so that he can breathe easily. There is no role of the common practice of taking a shoe near his mouth or taking onions or other objects which smell badly near his nose. That can cause harm to the patient and it is unhygienic. There is no role of putting in a spoon or any hard object, pushing it hard between his tooth, because that will cause injury to his tooth and it might injure his mouth and the tooth may dislodge and go through his windpipe to his lungs and occasionally can kill the patient. So absolutely no role of putting in a spoon or any hard object between his teeth during the attack which can harm the patient. Rather than that, the patient should be just made to lie down on his side and looking or checking that his airway is clear for normal breathing. Next point which is important is to remember that this attack will not last more than 2 to 5 minutes at the most in most of the situations. So it will pass off on its own within a few minutes. So please do not panic when there is any attack. After doing this, the person should immediately contact the nearest medical facility or a doctor so that the immediate care can be taken about the common problems. No unknown medication should be given after an attack which can occasionally harm the patient. Now, regarding the chronic or long-term treatment of epilepsy, this should be done by a physician or a medical practitioner who is trained to treat epilepsy properly. There are a lot of practices in our country with herbal medicines and various kinds of other non-medical treatments which can at times produce very dangerous results, because epilepsy, if the treatment is delayed, as days go by, becomes very difficult to manage later on with the common drugs, which could have been very easily treated if the treatment was started earlier. The most important thing to remember is epilepsy should be treated with medicines, and it requires long-term treatment. There is nothing called 2 years or 5 years or 7 years or treatment like that. This decision is to be taken by the treating doctor, and when to stop is to be decided by the doctor, because stopping the medicine on your own might result in a very dangerous acute attack of epilepsy which is called status epilepticus, which can occasionally kill the patient. So before stopping the medicine, the patient should doubly cross-check with the doctor whether it will be safe to stop the treatment or not, because there is nothing called 2 years, 5 years, 1 year or 10 years of treatment is sufficient. There are few epilepsies where lifelong treatment is required, and few epilepsies where 6 months to 2 years of treatment is required. This is decided by a doctor who is trained to treat this kind of patients. Never the patients or their relatives take the decision on their own, because at times this can be a killing disease if it is managed by the patients on their own. The other important part of epilepsy treatment is the regularity of the treatment. Taking regular medicine doesn't mean taking the medicine most of the days. Here, regular medicines means every day's treatment is essential. Even stopping 1 day's medicine can result in an acute or sudden attack of epilepsy. So, regular medicine does not mean taking medicine most of the days. Unlike many other diseases, in epilepsy, the treatment means everyday medicine is a must, because one missed dose can be at times fatal. So regularity of the treatment is very important. Thirdly, the other most important, another part of the epilepsy treatment is regular checkup or frequent checkup with the doctors, because these medicines occasionally or rarely can produce some side effects, like few allergic rashes or some liver problems or any other symptoms should be promptly reported to the doctor, because neglecting those symptoms can increase side effects occasionally of these patients. Now, regarding another common question is whether epilepsy is passed down generations or not. Very commonly asked question by the mother or the father is whether my child will also get my disease. Most of the epilepsies are not passed down generations. Most of them will not have their children affected by the same disease. There are few rare, very rare epilepsies where the epilepsy can be familial. Most of them are not due to genetic reasons. Thirdly, the problem is there are during pregnancy. Most of the drugs nowadays are very safe in pregnancy. There are many drugs now which are safe. Unlike the past years, in the olden times, the medications were harmful for the unborn child. But nowadays there are many medicines which are more or less absolutely safe for a lady to have pregnancy with the anti-epileptic drugs continuing. So an epileptic patient should not have any problem regarding marriage. So very commonly asked question is, my girl child has epilepsy, so what about marriage? So epilepsy should not be a bar for normal social marriages to occur. One should not deny a marriage because of epilepsy. Because most of the epilepsies are not familial or passes down generations, the child will not have epilepsy most of the times. And even if the mother is on drugs, nowadays the drugs are very safe for pregnancies. It's very safe for pregnancies. Rarely there are some problems, most of them don't have. Now, the other aspect of epilepsy is very commonly asked. Another question is, my child is having anti-epileptic drugs and they are not performing well in studies. Now these medications nowadays, again, unlike the olden times, these medications, most of them does not affect the brain power of a child. Many big stalwarts of our world, very accomplished and successful persons had epilepsy and they completed their academic career and they have flourished in life with anti-epileptic drugs. So epilepsy, even in the olden times and more so now with the newer drugs, they are not affecting the brain power or intelligence of a child taking long-term anti-epileptic drugs. So that is another misconception among the common people. Thirdly, epilepsy is something which can be, lastly, epilepsy is something which is a disease or a problem which can be very easily controlled provided the patients are regular with their medicine. I am emphasizing this more and more because many patients occasionally stop the drugs and come to us with severe resistant epilepsy when it becomes very difficult for them to control with other drugs. And finally, regarding the modern treatments of epilepsy, there are few epilepsies which are at times very difficult to control. One should not lose hope because at times 1, 2 or 3 drugs when they fail, there are other modalities of treatment also. Rarely, very rarely, few patients may need some surgical treatments which are also nowadays used. So one should consult with a treating physician for the modern day treatment because rarely they require some surgical treatments which can be used in few centers for controlling very rare cases of difficult epilepsies. This is also a very common question asked by many patients to me, whether it can be cured. Difficult epilepsies can need occasionally some surgical treatment.